I am from Wisconsin in America. Yes, for my 6-year rotation, or in America it's the 4th-year rotation. I am here for 6 weeks, and I actually am just finishing my 6 weeks rotation here at the university. So the pharmacy system in America is a little different. There are definitely some things that are the same. A lot of the pharmacists being kind of very knowledgeable about the drugs, their mechanism, when to use what drugs, how to use them. A lot of that is the same here as it is in America. In America, some of the differerences, I think, lie within the role that the pharmacist plays within the healthcare team. So in America, in the hospital, for example, the pharmacist spends every day reviewing patients and going on rounds with the rest of the medical team, similar to like the MICU here that I've been spending time with. The other role of the pharmacist in America is every order that the doctor prescribes is reviewed by a pharmacist before the patient receives it. So the doctor, for example, will order amoxicillin for the patient once daily, and the pharmacist will review that order and judge, is it clinically appropriate, is that the best order for the patient, and either say yes, that's good, or talk to the prescriber about ways to optimize that therapy for the patient. So really it's kind of a very team-based approach to healthcare. And I think that as pharmacy continues to advance here within Thailand, that's a great opportunity for pharmacists to be involved with the healthcare system. So in a community pharmacy setting like this one, it is, again, similar but a little different. So in America, in order for a pharmacist to dispense medication, they need a prescription or a doctor's note saying amoxicillin 10 capsules, for example. Whereas here, the pharmacist uses a lot of clinical judgment to determine what therapy the patient should get. So I think that this is definitely a good opportunity for pharmacists here in Thailand to use that knowledge that they gain through their years of schooling at the university in order to help patients get the best care possible and really use their clinical judgment in what should the patient receive. So it's a similar type setting. Like if I walked into this store, for example, it's very similar to America. It looks very similar. Except for in America, all of the prescriptions are all done from a doctor's order for a majority of these prescriptions, and then some of the over-the-counter medications the patient can just pick up. So I think that one of the biggest advantages that Thailand has in terms of their healthcare system and their pharmacy in general, the pharmacy profession here, is there's a lot of exciting developments and advancements within pharmacy within Thailand. So I think the field of pharmacy is still growing within here in Thailand, starting to have pharmacists look at managing chronic conditions, doing checking in on screening for high blood pressure, smoking cessation. All those opportunities really present new opportunities for pharmacists. So I think that is a very great thing for pharmacists to be able to kind of hone in on here in Thailand. Other things that I think are really great here within the Thailand healthcare system, pharmacist system, is really being able to have the pharmacist both be a part of the healthcare team in the hospital and then also work here in the community pharmacy to kind of do more of the diagnosing of the patient conditions that are acute. So, for example, a sore throat, or they have a cold, or things that we can help them with today that might not need a hospitalization, really having that primary care aspect of it.
Right.
I think that especially, so even in America, our pharmacy school can be very difficult at times, and can be a lot of studying, a lot of late nights, trying to get homework done, studying for exams. But I think when you finally make it through the program and get close to the end and are able to apply all that knowledge you gained is very exciting. So being able to help other people and help your patients from everything you learned really is where the payoff is. So my words of encouragement would just be to keep with it and keep fighting for through all the years of schooling, because at the end of the day, it's about taking care of patients and advancing the pharmacy profession.
Right, that's all about Eric from America, from Wisconsin.
From Wisconsin.
All right. Thank you very much.
Thank you. Thank you.
Hope to see you again.
Thank you.